All right. So, topic today, pelvic dysfunction issues, female perspective. I have Zeynep here, who is a physiotherapist from Turkey with kind of a specialty in the pelvis, and Sevinc, also from Turkey, who is kind of a pole mobility person who has worked with Zeynep coming off pregnancy to kind of get things back to where they were. Would you say that's accurate?
Well, yeah, at least get the things functioning well.
Okay.
Because I'm not sure if my pelvis was functioning well before even pregnancy.
Yeah. Interesting. Okay. And so let's start there. Let's kind of, Sevinc, let's start with you and all the things you've kind of noticed during pregnancy and post-pregnancy that you didn't notice before.
During pregnancy, to be honest, I did not experience pain in my pelvis. I thought that my pelvic floor was, maybe I didn't feel it because it was too tight. I thought my pelvic floor was just fine. So I kept on exercising, listening to my body, and I kept on exercising until the end of like 8 months even. My pregnancy was pretty easy going in that sense. So I didn't really feel anything peculiar during the pregnancy. It all happened after birth. It just felt like it was like explosion happened down there.
And so when you say after birth, do you mean literally delivery on? You were like, things are different.
Yes. Like things, well, obviously a baby comes out of your vagina, so things are different. Like they do experience the trauma. I don't think that's like necessarily talked about because people don't want to scare pregnant ladies. And I understand that, but also I think people just need to understand that it is a physical trauma. Like it doesn't necessarily have to be psychological trauma. In my case, it was both because my birth was really extremely hard and long. But it is a physical trauma. So things are never going to be the same.
Huh. Interesting. Right. So to kind of think of any kind of traumatic experience that you've gone through and the memory that sits with. So does it feel like it has that area has kind of a memory, or the whole body has a memory of the event, or not letting go?
Yes, I think I did have like a month-long nightmares. So like I said, mine was extremely traumatic. So, and also the pain continued. That's why I was like, I couldn't sit for 2 months properly. And I was feeling that something was wrong. And, you go to your doctor check after 6 weeks and they look at it, but they look at it from a point of like, did the uterus shrink? Is there bleeding? And that's it. Like if there's nothing wrong with your uterus, then they give you the, okay, you're good. And then I was like thinking, but I feel like there's something in there that's not supposed to be in there. And it's affecting my movement. It's giving me pain. I cannot sit properly. I cannot move properly. I can't even, like after 2 months, and I didn't know if it was normal or not, but like I couldn't even walk. And now I see my friends like just giving vaginal birth and walking around easily for 2 weeks. And I understand that it's not like everybody has a different birth experience, but in my case, something was wrong. So I just decided to search for myself, like based on what I was feeling, like something in there. Like I felt when I was trying to check what's in there, I felt like there was like something like an organ. And then I realized that I have experienced prolapse, which is your organs kind of like, I think Zeynep can explain what it is better than I did. But I was feeling like my organs was in my vagina.
Oh, so your whole midsection It wasn't
Yeah.
even this, okay.
Yeah.
And did you know Zeynep before seeking?
No.
Okay.
No, I did not. I went back to my doctor, my original doctor, and I was saying, look, I think I read about this and I like found this prolapse thing and I think I have it. But then like they're going off of like they lay you down and they tip your pelvis out. So the organs actually fall back in the body. So they can't see. Like in my case, it was an extreme. So they couldn't see it. Like, oh no, you're good. And the second doctor I went to, I said this. And then they said, yeah, you do have a little bit, like a level 2, whatever. I didn't keep track because after they said, your body won't be able to get back from this. It won't heal by itself. I stopped listening.
Ah,
and
okay.
I was like, okay.
Like, screwed. Sorry.
And I was like, I want to find someone who believes that the body can heal itself and work with me for this. And then I asked like a couple of friends who were like physiotherapist students at schools, and somebody, I don't even remember who now, gave me Instagram of Zeynep.
Okay. All right. So
and then I sent it, and then I sent a text to her saying like exactly this. Look, I'm an athlete, I do this and this and this and this. I have a prolapse now, I gave birth, it was traumatic. They tell me that I won't be able to go back to what I'm doing. Can you help me make this happen? And she said yes.
And you're like,
and all I needed was that.
Right.
Okay.
And it's so funny how the beliefs, right? Like the medical professionals' beliefs either, right, kind of dictate the course of action. Either you can't do anything about it, get used to it, which translates to, I don't know how to help you, but I don't really know how to say that. And then someone being like, no, we could actually work through some things. So Zeynep, if I pass the baton to you then, and let's kind of pick up what you noticed, the things you started doing, etc.
You mean specifically with Sevinc or
Yes.
in general? Okay.
Yes, in this.
So the weird thing with prolapse is actually, well, maybe it's not so weird, but like with any physical, solid, visual, like thing that is happening in the body, with prolapse, it's actually only 12% symptomatic. But if they examine women, especially who gave birth, it's like 50% of the women have prolapse, but only 12% is symptomatic. So there's a little bit of a, you can have it, but you might not feel it. But you can have just a, small prolapse like Sevinc did, and you might have a lot of symptoms. So it doesn't correlate, the symptoms severity doesn't correlate with the physical thing.
Got it.
And it's kind of like any physical, it goes for any physical issue. So in my mind, the prolapse itself, or like the incontinence, or like there's this thing called diastasis recti. It's the the abdominal muscles kind of gets apart in the middle. Those things are not the issue. They are like result of a system isn't functioning well, and birth itself, it's not really enough to create these things. So it's not like it's going to happen to every woman who gave or will give birth. So what I see is that you need to have something going on for some time, and it's basically related to the muscle functioning, because we have the pelvic floor muscles, actually the part of the local stabilization system. So it's not like movement muscles. So they don't produce any movement, so to speak, like our arm or leg muscles. But what they do is that they create a base for the movement. So they stabilize the skeleton so that we can move easily. Does it make sense?
Mm-hmm.
Okay.
It's involved in pressurizing as well, and I'm sure we'll kind of get to this in a little bit, but if you think of this cavity, that pelvic floor has to do with, if you think of prolapse dropping, things staying put, there being enough pressure there.
It's more like actually they function in a reverse way. So what it needs to, and it's not about the strength of the muscles, but it's about the timing. So how does the body work is that this stabilizing muscles, which it's obviously not just the pelvic floor, but it's more like a chain, and it's like starts from your foot and it goes all the way up to your head, and each joint has its own local stabilizing system, and it's all together, it's a chain local stabilizing system that it's, you know, goes throughout the whole body. But pelvic floor is like more, because it's location, it's central, it's kind of connects the lower body to upper body, and we move from center to the periphery. So it's kind of more like an, I'm not going to say important, but more like a central role to it. So if you might have a local stabilizing issue in one joint, like in your shoulder, especially if you get an injury to your shoulder, like a direct injury, direct trauma, this one shoulder of yours might lose local stabilization, because it's like when you get an injury or pain in anywhere, it is shown that the small muscles, these local stabilizing muscles, are the first one to shut off. And you might heal, obviously you're going to heal, but not in every case they start to work like they used to be in their own time. Sometimes you might need to, you know, like do something to make them work again, and that's the reason of the chronic, you know, like kind of like not healing injuries. This is the reason. So the tissue is healed, obviously there is nothing wrong with the tissue anymore, but it's because the local stabilizing muscles are not functioning, and it's the timing issue. They're not working on time, so it kind of creates more load on the movement muscles, so you keep feeling the pain even though there's no real tissue injury anymore.
Okay, so do you in the word in Turkish, the word hammock, if I say the word hammock, is that kind of that idea of the hammock has to give when it's supposed to give and be tense when it's supposed to tense? Okay, so if I think of it as a hammock, I'm like, okay. So Sevinc comes to you with this prolapse, and you're confirming, yes, things have dropped. What do you do? What's the treatment start? What's the advice? What's the...
So the treatment is, the goal is to make those pelvic floor muscles work in the right time, and also in the right direction, because two things, especially with the prolapse, main thing is that normally when we breathe in, you know, we expand, obviously, like a balloon. So the diaphragm and the pelvic floor muscles and the abdomen goes out. Okay, and when we breathe out, it's the opposite. Everything comes, you know, like in. So pelvic floor comes up, and also abdomen comes in and up. You know, so this is the natural movement of the let's say core stabilizing system. What happens in here is that when you breathe in, and this is really interesting. This is called paradoxal breathing. Maybe you've heard of it. And it's actually, it happens in people with neurological diseases. It's like the diaphragm doesn't get any, like neuromuscular input. It's like, like it's just sitting there. So what happens is that when you breathe in, all the air goes to your chest. So your chest expands and your stomach comes in. And when you breathe out, it's like your chest is pushing down. So it's like you're straining all the time. So there's a straining, pushing down, thing, whatever you do, even like you're walking, you don't even need to, lift heavy things or anything. It's just your daily movement slowly strains your pelvic floor down and everything inside stomach obviously down and down. So of course it's going on for a long time before everything gives in. But if something happens like being pregnant and giving birth, obviously it's a huge change in the body. So that might be a point that everything is like breaks out. So what we're trying to do is that first change the direction of the work and make them like activate in their correct timing. So before and it's before the movement muscles.
Okay.
So what I've tried everything, like there's a direct connection between transversus abdominis and the pelvic floor. They work together. So I tried working on transversus abdominis. I tried, adductors also have a direct connection with the pelvic floor, and that's like the most popular exercise, squeezing a ball between your knees to activate the pelvic floor. So I tried that. I tried everything, but I realized that actually like intentional conscious movement doesn't work to make them activate again, because if you're making a movement, you're going to use the whatever the pattern you're using. So you need to like come back. And I don't know how I come up with this really, but I start using breathing, especially the exhalation. I realized that the exhalation has this a natural effect on like making the pelvic floor like work in its own time. So I use this specific breathing exercise to like make the body find that natural activation of the pelvic floor and the core system. And what we do is that we start on supine. It's the easiest place to be in, and then we work our way onto like rolling and onto on all fours and all the way up to the standing with that breathing is in the focus.
Okay, so that makes perfect sense. If I flip it to Sevinc and I say, what was, as you were going through this process, what was the first big O to you as you're working through this timing, this breathing, this exhalation? What was the first thing that really was that light bulb moment for you as you were going through this and trying to figure things
out? It's interesting because I have been nerding out on this book called Neurodynamics for a long time. I completely forgot. Dr. Theodore Dimon is the writer. And he explains basically the same thing. Your nervous system does its own thing and it's automatic. And if you want to change any pattern, you need to reset the nervous system first. And it's like a course that he gives in a university. So it's 4 years long. Like all the lessons that he teaches are in this book. So I have read this book and I understood it. And I was like, okay, this exercises make sense. And then when Zeynep first laid me down and explained, like walked me through this breathing exercise. It's not the same exercise as in the book, by the way, but it kind of like clicked. And I went to all of those things that I read. And it made so much sense to me, to my brain and to my body at that moment. So I would say like the first day that she had me like breathe in her office was the thing that it clicked. And I'm glad that it did, because if it didn't click, I don't know if I would be able to mentally hold myself back from doing anything else other than breathing for 5 minutes in a day to get better, you know, because it's like this, the trainer, the athlete in me who has learned all of this like progressive things to be able to get stronger. You need to do this and you need to do that. And I was like there breathing for 5 minutes for 2 months, by the way, not just like for a week or two. And then I'm thinking, this is gonna have me heal and get stronger breathing. And then I had to like sometimes write Zeynep messages, and I was like, could you please explain to me one more time how it's gonna work? So
Which completely feeds into the last chat we had with her, where it's just like people want more. And again, it's the consistency done well. So while you were doing this 5 minutes, so basically you just did this practice for 5 minutes a day for 2 months.
yes,
That was like,
yeah, and I mean, for 2 months before I went back to her again, and then we add some like rolling things that she was saying, and then it was another like, you know, couple of months of this just rolling. It's not like, you know, I take a breath in for 5 minutes every day for 2 months and I was back to what I was doing before. It was very gradual. It was like what she said to me the first day that I was there was like, you're just gonna follow your child's process of like, you know, she's now on her tummy lifting her head up, you're gonna do that, and then she's gonna roll, and then you're gonna start rolling, and she's gonna crawl, and then you're gonna start crawling. And that's what I did basically.
so, and it's funny that you use, you know, I'm sure as you watch your child, you're like, oh yeah, like this leads to this. Huh. So what percent would you say that you're good to go, Sevinc, as a result of this?
Right now?
Yeah.
I think I still have like, I mean, it's very specific. If I had a normal life, I would say 100% that my, you know, if my life didn't demand my body to be like more than 100%, I would say good. Okay, I don't need anything else. But like the other day, I was doing a sissy squat like move, and I felt something was off again. And I take a video because I also have the diastasis recti, the separation of the abs. You know, because if the pelvic floor isn't in, like, if the core isn't in good coordination with each other, then diastasis recti appears again, like my abs separate, and you know, you see the tissue coming out of it. So I was doing like a sissy squat thing, and then I saw that again, and I sent a picture to like video to Zeynep again, and she's like, okay, maybe your body's not there yet, like take it easy, or your nervous system needs to understand what's happening there again, because I haven't done it since giving birth. So I discovered these things like 2 months ago. I still have like incontinence while jumping on the trampoline, only with my legs together, which was weird. But now it's gone. Like, so now I can jump rope with my legs closed and it's fine. But like, it's healing. Like as I go along, I just like try to observe what's happening. And if there is like, if my body gives a signal of like, oh, maybe not this yet, then I went back a couple of steps and I just don't push it. So I would say I'm okay right now. Like if I'm doing just daily things, then I don't have any symptoms, I don't have any problems. But as I do floor acrobatics or crazy things on the wall, sometimes it's gone again. And I was like, oh, okay, maybe I need to work on this movement a little bit more consciously and aware.
I think it's just very, it's healthy instead of blaming your body for not being ready, to say like, oh, this is a process, I need to back off, right? Instead of getting upset and angry, for that to just to be a flag, to be like, we need it, our breathing isn't set right, our coordination isn't set right. So because I'm sure as an athlete, there's a frustration to not being where you want to be at a certain time.
Oh my God, so much. And my ego definitely took more than a couple of hits. Like when I was showing like, I can't even do a hollow body right now, for example. I know that my core isn't there yet. And I know now that my core actually wasn't there 2 years ago either.
I'm curious into that. How do you know that pre-pregnancy you were also off?
Because after I did these exercises with Zeynep, and after I like gained some of the coordination back and started doing like the usual kind of work, I would say, that I was doing, I have never felt so, like my limbs and my core never felt so connected before. And I was doing like more hardcore stuff, but I can realize now when my body is like, because before I didn't have a reference of what it's supposed to be when it's coordinated and used well. I thought, you know, if I can do it, then it's working. But now, because I have a reference of what it feels like in my core, like in my body, in my breast, and in my, I don't know, skin even, when it happens, I have a reference of, oh, now I'm compensating. Like now I'm actually not ready. And the feeling of compensation is very similar to what I was feeling before birth when I was training almost all of the time.
Right. That makes sense. So did you find, if we jump into the incontinence issue, that the breathing work, that cleared it up, or was there another layer that had to go through not peeing on accident?
For me, the incontinence was only a problem if I sneezed really hard and if I was holding it in for a long time. It's
Okay.
not like, you know, it happened all of the time. I didn't have so much of an incontinence as a symptom. It was more like the weight that I was feeling in my vagina that was messing up with me. But still, it's not nice if if you hold a little bit longer than when you need to go to the toilet and you sneeze on accident.
Right.
Nice.
And you have to, holding it in general is a pressure change or is an adjustment. Yeah. So if you're trying to get expansive breathing, and part of you is like, don't let go. Like, things are gonna adjust a bit.
Yeah. So naturally with the breathing, but I would say like with the breathing and with my awareness to adjust my training to the level that I'm at right now, which is in my case like a mental issue. Like I am aware, I have the awareness, but to be able to let go of the idea that I want to do right now and just switch gears to whatever I was doing, whatever I can do, whatever my body wants to do, then it was the result, I think, like what led to incontinence being gone.
Gotcha. Zeynep, if I swing it back to you now, you see a bunch of people, male and female. Is this particular breathing practice kind of where you start everybody, or is there a different sequence for different issues?
Well, if it's a local stabilizing issue, which it is with most of my patients, because people find me like after they have these problems for a very long time and couldn't figure it out, couldn't get help from anywhere. So it's chronic, and with almost all of the chronic issues, there is always a local stabilizing issue, a problem. So yes, almost all of my patients, I start with this breathing exercise, and then we work our way, and everybody's process is different. Like for Sevinc, it's really specific because she has a very specific, like movement practice on her own. So she kind of like takes my, takes my exercises and she kind of plants them into her, like movement practice. So it's Sevinc's process, and it's different for everyone. So but the starting point is the breathing, because at first I was like getting nervous that of like sending people out just with a 5-minute breathing exercise. I was uncomfortable, like they come here, they pay me a good amount of money, and then what I give them is just 5 minutes of breathing and that's it. I was uncomfortable with it, so I was trying to give all the exercises at once, and I realized that it doesn't work, because if you give them a movement that basically that something they need to do, and then the whole focus is just doing that movement, and then they just use the old habit, and it doesn't change. So for sure they need this they need to really spend some time with this breathing exercise for a couple of weeks before we start doing any movement, because when they start to move, the body will certainly try to go back to the old habit. So that's what we're trying to do, is to when it uses, like Sevinc said, when it starts to compensate, so that they can feel that, so they can realize that, and they can stop and not do further. That's the whole point of the exercises, actually, to feel where you are moving comfortably and where is the point that you cross your limit, and then you're compensating. All I'm doing is trying to make them understand and feel that difference when they are doing things.
The time period. So Sevinc said 2 months. Was that because of her schedule? Like, why the 2 months give this a go? Why that prescription?
As far as I remember, she traveled to US, I guess. That's why it was 2 months, right? So it's not like we're not like in hurry. So it's not like it doesn't need to be like in specific amount of time. But how I do it is that I usually give them 2 weeks. I usually do the sessions every other 2 weeks. 2 weeks is a good time to see some differences, and then to add on something else to work on. But again, it's very personal. Sometimes people might need more time to work on something, especially when we start doing the movements like rolling, etc. They might need 3-4 weeks. But sometimes it's not just a physical process, but it's more like a mental and attitude issue. So sometimes we all grow up in in a world that teaches us, as much as you do, you will get better. So it's hard to really stay with the idea of no, I don't need to do it, I just need to feel the difference. And then if I'm compensating, oh, it's okay that I'm not doing it. So they might get lost and fall back to the old habit mentally. So they force themselves to do things. So that's why it's good to keep the 2-week scheduling. But Sevinc didn't need that. Not everybody needs that. But 2 weeks is good. But again, sometimes I work with people and we have absolutely no development at all, and they just stay at exact where they started with me, and they just don't come to see me anymore. That happens too, because it's really, you know, like hard to wrap your mind around, especially if you grow up in a modern society.
That idea of more and let's get through this. I should be done with this by now. When you start to bring the movements in, do you coach the sequence, or do you just say now add and see what happens?
I have a frame, because we don't have much connection with our bodies, so we don't really know. And what I see, especially with these people who's having these problems, they don't have much of a connection with their body. So at first, if I say, okay, now you do whatever, you know, like you feel like doing whatever your body wants to do, it's kind of a blank, you know, nothing comes up. So I have a frame of work that I start with the hip movement, because it's kind of like something we use as a baby. You know, babies start to roll from their hip and pelvis as a reflex, and then the movement kind of like spreads down to the legs and up to the body and the arms. So I start with the hip movement, and then I, you know, like work my way out to rolling, and then I kind of show some examples from my body, but I, you know, like underline that it's my body, it's what happens in my body. That's because that's the only reference that I have, that I'm giving you, but you need to listen to your body to find your own way, you know, like underline, and then, you know, like, yeah, so they get there.
Yeah, okay. So Sevinc, nowadays, right? So you have this breathing understanding. How do you integrate it? Do you still have moments when, like in those times when you're like, I'm too far, I need to peel back? Do you revert all the way back to lying on the ground and getting the breathing right and then try to integrate it? How do you use the things that you've been taught in present day?
Yeah, of course, I do have days and sometimes weeks that I go back to the first breathing exercise, and I love it. Honestly, I do that as a meditation right now because it's really easy to, like, you know, it also helps you relax. So in the end, I was like, okay, I can actually continue to do this every day. So if I feel like it, if I feel stressed, or like right before training, right before warming up, I definitely do the breathing exercise. It depends which version I choose to do, and then it's translated starts, like if my body wants to roll, then I start rolling, and then it becomes some sort of floor work, and then it becomes some sort of, sometimes it becomes acrobatic, sometimes it becomes a handstand exercise. So I don't like plan my own training anyway now. I just have an idea of what I would like to work on in different fields of movements that I do. And when I start with the breathing exercise and a movement, and then just follow my pelvis in that case, I just go wherever it wants me to go and be comfortable at where I land. But sometimes it's still like I realize, especially if I'm stressed, it just goes way back. And then I'm like, maybe I shouldn't train at all today. Because I feel like, because stress affects our bodies in, like, in a way where, you know, when we are killing ourselves, the exercise does. Like even worse. Like I feel it more now because I am more connected to that part of my body. So if I'm just stressed or upset for whatever reason, especially for a couple of days in a row, then in the third day I'm like, yeah, I am for sure gonna compensate if I train today, because I'm not connected. I'm not mentally able to be aware of my body, first of all. My breath is not there. My pelvic floor is too tight and it cannot relax. And when it can't relax, then it doesn't coordinate well enough with every other thing anyway.
Right. When you get to when you are having a good day and you get to a good day, a connected day, and you get to the harder core movement work, do you find that you're still, even within this complex thing, that you're still relating and checking on that breath and that position and that tension?
Definitely. Now, like, because Zeynep explained it like a minute ago, I do found a way to integrate it with my training and the way I teach, not just my own training, but the way that I teach now. My students have become more breath aware. So I would like first have them understand the combo and just cue in the breaths, and like, you know, because there is like a natural flow of the combo where we would like fight the gravity or relax with the gravity, and the breath, how it goes with this. Then I start to like get their attention to their own breathing and like to listen to their own body. So the way that I train is very similar to this, and I'm always like just following the weight shift of the pelvis. For example, when I'm doing acrobatics, I'm not thinking like my leg should be doing this, my, you know, my hips should be doing this. I'm just thinking, okay, where is the weight transfer and what is my breath doing right now?
And they've been receptive to this new breath cueing?
Yes. Oh my God. I have improved in my acrobatic skills so much especially in the past 3-4 months, where I'm like really able to, like, I feel like I have come to a point where I can actually train. If I'm having a good day, for example, I have improved in everything, and much more than I had before. I mean, of course, there is like some skills, like what would it be? Some things that I'm not able to do because I shouldn't have been doing it 2 years ago either. It's not there. Like, I wasn't actually strong enough to do it. I was just pushing it too much. Now I'm not. Now I'm like patiently waiting, and some of the things I don't even want to do anymore anyway. And when I just relax and go with the flow and just feel what my body wants to do, in everything I have improved so fast.
Excellent. Awesome. I think maybe a nice loop around would be to address the thing that we haven't yet, is that idea of the diastasis recti with the split of the abdomen, because you mentioned that it is a different thing than the pelvic floor. So is it a different type of breathing? How do you go about, if I flip it over to Zeynep, how do you start looking at that piece of the, if you think of that vertical line of that expansion and trying to bring that back together, or at least connect it along the halves, left, right?
So the mechanism behind it is that the abdominal muscles are like, you know, 4 layers. And the deepest layer is the transversus abdominis, and the outer layer is the rectus, which is the 6-pack, you know, and they have different fiber lines. So the rectus goes like this from it's vertical, and the transversus is actually like this, it's horizontal. So when they start to work from transverse towards the rectus, what happens is that when transverse starts working before rectus, it creates this, you know, like this effect. And then when the rectus is contracting here, it's closing. Okay, it's closing that line together. But if the transverse is getting late, which is the case with this local stabilizing issue that I'm talking about, the transverse it's late to work. So when the rectus starts to work first, what happens? It goes like this. You know, it creates an opening effect on that line. So that's how that diastasis actually, you know, happening. And And I see it in patients that were never pregnant and they haven't gave birth, like 20, 22 years old people might have this gap in that line. So that tells me that they have been using their body with this mechanic that is transversus abdominis was late when they were moving, maybe since their childhood. So, and another thing with the diastasis is that it actually is happening in every woman who gets pregnant, because obviously if the belly is going to get that big, so the muscles are not going to stretch that much. So rectus is actually it's natural, it's normal, it's opening up from that line. And then what we expect is that if they have this transversus abdominis working mechanic is, going on in the body, after the birth, in about like 8 weeks, it just closes back up normally. And if it doesn't close up, it depends on, like how severe it is. If it's too big and too much, I would still consider that it was like this mechanics was going on for some time, like for that person before even the pregnancy. But sometimes, maybe the birth might be too hard, or there might be a C-section or some sort of like that would, create an initial original trauma. And again, that might turn the body into work in a way that transversus is getting late. But then that diastasis doesn't, like feel so severe. And with that breathing exercise, you can actually feel that, like in that session, like I tested and there's a gap, and then we do the breathing exercise and then we test it again, and you feel that like closing movements around your fingers, and it's like, okay, we did it. But then to make it the habit of the body, you need to keep doing it, because when you start doing your daily work, it's just gonna go back to that habit. But if you work every day, and then at some point it's just going to be your that not the old habit anymore, but that's going to be the habit of like using that mechanic. It's going to be the default mode of the body. That's what we're trying to do. But like as Sevinc said, stress has an enormous effect on it. And I think it's important to point that it's not like a process of like you're getting better and better and better and you just keep getting better. It's not like that. It's like life, like, and especially for a mother, like for a person who gave birth, I mean, you have a baby that you need to look after, and you're probably not sleeping well. You're probably, like you don't have enough time to care for yourself with the baby. So obviously it's gonna take a little bit more time, and that's fine. And sometimes if you're just tired, this is life. If you're stressed at work in 1 week, you might feel like, like you felt back to that old habit, but that's fine. That's normal. It's just, if you realize it and you're like, oh, okay, I'm tired this week, so I'm gonna just, like do too much training this week, and you'll be better in the next week. But if you keep pushing yourself, and not realizing that, that's the real danger, that you're probably gonna hurt yourself at some point on the way. That's the whole idea, I mean. So that's the issue with the diastasis, recti.
And so is it the same magic breathing exercise, or is it different at all?
No, it's the same thing. The idea is that rectus starts to work before the transversus, and that creates that gap. And another thing I just remembered, there's this whole, excuse me, but, in the gym and Pilates and yoga, world that everybody keeps saying that squeeze your abs and pull them in, and that actually you're kind of changing that natural process into the wrong one. And you're creating a mechanic that is actually gonna get you to that diastasis at some point.
Right. But it's like, it looks good, right? It's the whole like sucking it in process. Like,
I'm gonna tell you, I'm gonna give you another secret is actually, that that belly goes out from, like below the navel. That actually is because of the rectus abdominis is too tight. And if you let go of your rectus, because the transverse is gonna, like work its way up, you will have more flat stomach.
You heard it here. And I'm also, for anybody like watching or listening, I'm going to try to get Zeynep to give us pieces of this magic breathing exercise in a video or an article or something.
Of course.
So that would be excellent. Even I know we're circling around. I'm like, what is it? So to come, hopefully.
You're gonna be disappointed.
No. Like, and again, like, and here's the thing. Like, again, if people don't understand the gift they're given, not the gift's fault. So
yeah, that's true.
Yes, and if I finalize back to you, Sevinc, as far as both your prolapse and your diastasis issues, would you say that they both cleared up pretty equally, or is one lagging the other, or is it just like on a daily basis?
It depends. I mean, if I'm, like I said, nowadays, because I'm really conscious of my training, I don't really get symptoms out after, because I don't hard train. Like, I train, but I don't train myself to exhaustion. So the only times that I feel symptoms is if I'm extremely stressed, like for a couple of days too, not just one day. Like if I'm extremely stressed, then I start to feel a little bit the prolapse. And I mean, I want to be clear, it's not like, this breathing takes your prolapse back up. It's not like it gets the symptoms go away. Like I don't feel it. I'm not sure if my organs are actually back where they're supposed to be. I haven't like checked that, but I'm not interested. Like I just want to be able to not feel them. And like my pelvic floor and my core working properly was my goal. So if I feel the symptoms again, then I know to stop. And my diastasis was not that bad to begin with, by the way. And it healed, quote unquote, faster than the prolapse because I was being really careful. I feel like, and now I can actually check it myself, in the linea alba, like the in-between, the line between has started to gain tension. But I'm also still breastfeeding. And I know that while you're breastfeeding, prolactin is still active. So my tissues are still lax. Like if I'm not moving, for example, if I really let go, breathe out, like you can see the diastasis, like a little bit, like when it's in a relaxed position, it's not like tight as it was before. So it's still like, it's getting better. And I can feel like the tension is not, at least I cannot like go touch my spine anymore. I was able to do that. Like if I, yeah. So it's gaining tension, and I'm sure it's going to be much better after I stop breastfeeding, but it's up to my daughter. I'm not rushing her. So I accept the fact that it's going to take some time to completely, like, especially I feel like the diastasis is just going to go away. I don't know if prolapse is like gonna go away and never come back again. But it's like, as long as I know how to deal with the symptoms and make it better again, it's not a problem. I'm not worried.
Excellent. Many things to think about, as always, with you guys from Turkey. Any last comments or points to throw out there?
Don't suck your belly in.
Exclamation point. I like
Yes.
Yeah.
I like it.
Yeah. Don't suck it in. Don't squeeze it in, please.
Yeah.
Let it go. Let it go. Conscious, self-conscious.
Let it
And I
go.
mean, also don't like try to, like nowadays, like because I had this habit, not just habit, but also like understanding, because we learned that, you know, if you squeeze a certain muscle, the other one will relax. So as you're stretching, you consciously try to, or when you're training, you consciously start to squeeze one muscle, like you, as if you're willing it to work more. It's just, I mean, don't squeeze your butt just because. Like, just find a way to make your butt squeeze naturally. Push a wall, for example. I don't know, or try to lift your leg up. It will squeeze like hell. So
Right.
don't mess up with the nervous systems, like, you know, because the body knows what to squeeze when. I think it's a matter of trusting your body's wisdom.
And not forcing any shoulds that you're not sure actually should be there. You just heard
Yes,
about it.
definitely.
Awesome.
Yeah, it is kind of weird that, you know, like, you know, this whole sensory motor system is actually controlling this, and we have like, I don't know, 50 something joints and over 600 muscles working together to, you know, and we do these, you know, like movements that, you know, like in every angle, and it's so complex, but still we can move like, you know, really elegantly. And we think that somehow with our mind we can control, and you know, we can control our movement. It's just, it's weird.
We can make it better. The will, the improvement, right? Like, where the real answer is just let go more. Let go more.
Yeah. If we let that system, you know, like work its own way, it's gonna be okay. But yeah, we just want to intervene.
Perfect. I like it. I like it's that simple. Now go do, like, but not easy to implement.
No, it's not easy.
Definitely. I have struggled with it a lot. Like, I'm not gonna lie, it's hard. It's like, so what? Am I not gonna plan any training right now? How is that gonna work? So I'm not gonna like make a set and rep situation going on. What's gonna happen? How am I gonna know if I'm improving? It's hard. It's not easy.
Right. The plan is, we'll see. Let's try. Which, again, with people who right, feel very in control of things, and control has worked in the past to get them all the things they wanted, they're going to assume, oh, I'm just not trying hard enough. So
yeah.
Culminating statement: less is more. Less is more.
Definitely, for sure. Excellent.
Well, I hope you guys have an excellent evening where you're at. Thank you for chatting as usual. And I'm going to get on you for that video in a few days, Zeynep. But awesome. Always a pleasure. And I'm sure I'll talk to you guys soon.
Thank you.
Thank you so much for a great evening as well. It was the highlight of my day.
Oh, goodness. Thank you.
Exactly. Highlight of my week.
Okay. We'll have more then.
Definitely.
Night, ladies. Bye-bye.
Bye.